Okay, so we're on Unit 3C, Part 2. Here's the homework questions from yesterday. Okay, so today, one of the things we're talking about, it's all about experiments, but comparison and control groups. This is like fundamental to an experiment. So we use a control group. Usually, most experiments have a control group. It's used to provide a baseline for comparison. So we use it to compare, how effective our treatment was. The drug we give, whatever it is, depending on the purpose. You may be given, sometimes the treatment is what we call an inactive treatment or a placebo, or it could be an actual drug, an actual treatment, or no treatment at all. So occasionally there actually isn't a treatment for the control group, but typically you get the inactive treatment for the control group. We're regular screening for children for the malaria parasite, and treating those who test positive reduced the proportion who develop disease. So they worked with 101 schools in Kenya, randomly assigned half the schools to provide regular screenings and follow-up treatments to students, and the remaining schools to provide no regular screening. Children in all 101 schools were tested for malaria at the end of the study. Why is it necessary to include a control group of schools that didn't provide regular screenings? So we want to see how much of a difference it's made, right? So it's for comparison. How effective was the treatment? Well, if you don't compare it to anything, it's hard to say. So we want to compare it to a group that didn't get treatment and see, because maybe, things are looking up for the country and then everybody's not getting that disease anymore. And so maybe you want to have a comparison group to see what's happening. They won't be able to determine if the decrease in malaria was due to the treatment or maybe some other change, like a drought that could have killed off the mosquitoes. Oh, that's a really interesting point, because mosquitoes are many times the way that malaria is spread. So yeah, there could be some big environmental factors that could come into play. So having a control group, really smart move there for that experiment. In that one we just did, remember the units are actually the schools, not the students. We didn't treat each individual student. Half the schools were assigned regular screenings. So the decision about who to screen was made by the school, not the student. All students of the same school received the same treatment. What is the placebo effect? So when you do give a fake drug, like a sugar pill, and it looks like the real drug, you think you're taking the real drug, but it's not. Sometimes students respond, the subjects, the experimental units will respond favorably. It's called the placebo effect. They might go down a few levels, a few numbers in cholesterol level or something. It's going to have a positive effect many times, a small positive effect. In a double-blind experiments, neither the subjects, like the experimental units, or the people who are giving the treatment, so the doctor or whoever it is who's giving you the drug, oftentimes doesn't know if it's a drug or not, if it's placebo or the real drug, because it's a double-blind experiment. So double-blind means you, the person who's getting the treatment, doesn't know, and the person who's giving the treatment you doesn't know. Single-blind happens when either the subjects or the people who are an expert with them don't know. So typically, a single blind would be when the doctor knows what he's given you, but you don't know. So that could be an example of a single blind. Some doctors use magnets. I don't know how that could possibly work to treat patients with chronic pain. Scientists wondered if this type of therapy really worked. I have my doubts that it will, but it might. Who knows? They designed a double-blind experiment to find out. Well, that's a good way to test it. A total of 50 patients with chronic pain were recruited to the study. Doctors identified a painful site on each patient, asked the patient to rate the pain on a scale from 0 to 10. Then the doctors selected a sealed envelope containing a magnet at random from a box with a mixture of active and inactive magnets. It's an inactive magnet, just like a hunk of metal that doesn't magnetize. The chosen magnet was applied to the pain for 45 minutes. After being treated, each patient was asked again to rate the level of pain from 0 to 10. So we do have a control group that was given inactive magnets. They think they're part of the group, but they're not. So what does it mean to be double blind? That means the subjects or experimental units don't know if they have a magnet or not. And the doctor doesn't know if you just give them a magnet or not, right? The doctor or whoever is administering the treatment. Why is it important for this to be double blind? Because human nature, I mean, so doctors usually have these big grants. They want this study to be successful. And so if it's not double blind, they might, I don't know, they could be even tempted to fudge the results a little bit. Or if it's just kind of a judgment call, they make the judgment call in the favor of the study. If they know the person is getting the real drug, that could really alter some of the data that's collected. It's possible, at least, that it could. If subjects knew they were receiving the treatment, researchers wouldn't know if any improvement was due to the magnets or to the expectations of getting better. If the doctors knew which subjects received which treatments, they might treat one group of subjects differently. They would make it difficult to know if the magnets were the cause of the improvement. So they could treat them differently. They could ask the questions. They could sway those results sometimes if they know. It's better if they don't know, so they're not tempted to again kind of fudge the results a little bit. An experiment, random assignment, means that treatments are assigned to experimental units, or experimental units are assigned to treatments using a chance process. In a completely randomized design, the experimental units are assigned to the treatment completely at random. I like a completely random design. It's nice. Diagram, what's that look like? So say you have 20 students. We randomly assign them into two groups. One of those groups, and we like to have equal size groups. Just generally, that's what we prefer as statisticians. Usually better. One group, we give them caffeine, like Cokes or something. Another group, we give them caffeine-free Coke, some kind of thing where they think they might be drinking caffeine, but they're not. There's no caffeine in there. And then compare the changes in pulse rate. So see if there's a difference at the end. So find the results. If you were asked to describe a completely randomized design, stay away from flipping coins. It's kind of a nuance there as to why that's bad, but we prefer not to use flipping coins. We rand int on the calculator is a great way to do it. When you need to choose things randomly. For making a vaccine publicly available, pharmaceutical companies must conduct well-designed experiments called clinical trials to demonstrate a vaccine's effectiveness and safety. Some of the most important trials in recent years were in the various COVID-19 vaccines. In Pfizer's clinical trial, half of the 43,000 subjects were randomly assigned to receive 2 shots of the vaccine 21 days apart. The other half were assigned to 2 shots of a saline placebo that doesn't hurt or help anything, or shouldn't in general. After several months, Pfizer determined that its vaccine was 95% effective in preventing COVID-19. So I definitely hope that would be a double-blind study, because if it's not, they might be, again, there's a lot of money at stake when you get a vaccine approved. You want it to be completely random there and double blind. Describe how Pfizer could have randomly assigned these subjects in a completely randomized design. So number of subjects from 1 to 43,000. Use a random number to generate 21,774 integers. Again, the subjects who identify the subjects who correspond to those integers, and the remaining amounts of folks will be the placebo group. How could Pfizer have randomly assigned to treatments in a completely randomized design? We could use a table of random digits. To do it, you would take, however many numbers at a time, or 43,000 slips of paper. Be sure to shake the hat to randomize, or use a random number generator like randint. What is the purpose of random assignment? I really like this definition here, this thing they say. So when you have random assignment, it creates roughly equivalent groups. And that is what we want. We want to choose roughly equivalent groups, and that's what random assignment does. Let me go back to, I just want to see if it said something there under random assignment. I didn't say anything there about, I thought they might say it before that. I thought maybe I missed something. I was just checking. Okay, roughly equivalent groups. So that is key. I want you to know that script. I need you to know that random assignment creates roughly equivalent groups, which leads to, representative samples. We want that. You want to have randomly chosen roughly equivalent groups. This allows researchers to make a cause and effect conclusion because it's an experiment with random assignment. So you must have random assignment with the experiment, at least for AP Stats terms, you have cause and effect. Replication is that you have enough of a unit so that chance doesn't foil our results. So use enough subjects, right? So if you don't use enough subjects, if your sample is too small, replication will not be there, and the results can be very flawed. Don't look up this term in the internet for replication because psychology, different fields define it completely differently. So in stats, did you use enough subjects, or should you take in a larger sample? Experiment control means keeping other variables constant for all experimental units. I really like using control, so it's really good. I consider the caffeine experiment. It's important for each student to have the same amount of cola to drink. If each student were able to drink as much or little as they wanted, wow, you get a lot of caffeine or just a little caffeine, and that can make a big difference as to how your pulse rates might be affected. So having more variability in the amount of caffeine you drink doesn't lead to better conclusions here. So here's a visual. So this is the result when you kept the amount of soda constant. So caffeine, you can see clearly there on the right. Pulse rates are, the change in pulse rates is you tend to have a positive change. All of those are above 0. Whereas no caffeine, you tend to be, you can go either way. So you might have a negative or positive change to your pulse rate with no caffeine. That's interesting. Maybe just the sugar or something is doing it. I don't know. Change in pulse rates, letting the amount of soda vary. So if you just let the participants kind of go, drink however much soda you want, but just drink this particular thing, which happens to be caffeinated. Look at how spread out the data is. So not nearly as good a data as we had before. So I think it's better to control that other variable of how much soda you have. Researchers in Canada performed an experiment with the university students to examine the effects of multitasking on student learning. 40 participants in the study were asked to attend the same lecture and take notes with their laptops. Half of the participants were randomly assigned to complete the other online tasks not related to the lecture during that time. Oh, that's interesting. So they're in class, and they're supposed to do stuff other than just learning the lecture. These tasks were meant to imitate typical student web browsings during class, okay? The remaining students took notes on their laptops. At the end of the lecture, students were given the same test about the content of the lecture. Okay, identify 2 variables that the researchers kept the same during the experiment. So what did they keep the same? So it says they attended the same lecture. I think they all had laptops. What's the second thing? All students were given the same lecture and they were given the same test at the end. So it did talk about at the end, the same test was given to all of them. describe a benefit of keeping these two variables the same for all subjects, for all the participants, for all the students there. Yeah, I mean, you don't want it to be a different lecture. You want to see maybe, because maybe they just didn't learn from the lecture, but it's the same lecture. You can, take that variable out of there. Students attended different lectures or took different tests. The test score is likely to be much more variable than if the lecture or test the same. This increase in test score variability will make it harder to find convincing evidence that multitasking is harmful. It also helps us to avoid confounding. Confounding always might happen some, but it helps avoid it or lessen it maybe. Remember, the idea of confounding is when you don't know the difference in multitasking or the difference in lectures caused a difference in the test scores. We don't know what the real cause was. These are the 4 principles of experiment design. You need to know these. These are biggies. So whenever you're designing an experiment, which we're kind of getting into now, you want some comparison. Compare 2 or more treatments. You want to have a control group, maybe a couple of treatment groups, but at least one treatment group. Use a chance to assign experimental units to treatments or treatments to experimental units. So, I mean, these 4 are just really big. You want the comparison, so usually that's a control group. Random assignment, create roughly equivalent groups. Replication, which means, make sure there's enough people or experimental units that you're studying so that the results can be distinguished from just getting the results by chance alone. And finally, control, well thought out comparison experiment will keep as many of the variables the same for all the groups. So you control someone's diet or their exercise regimen, as much control as you can have on some of those other factors. You can't control everything in someone's life, but it helps to avoid confounding and reduce variability if you can have some controls set up for an experiment. You're done with the lesson. Let's look at a couple examples. So Rwanda wanted to increase the literacy of its school-age children. It considered providing teacher training and educating families and communities to support learning outside of the school, in addition to the teacher training, an approach called Literacy Boost. The country of Rwanda is divided into 30 districts, which are in turn divided into smaller regions called sectors. Researchers randomly assigned all the sectors in one district into 3 groups: teacher training, literacy boost, and then a control group that received neither the training or the literacy boost. Explain why it's necessary to include a control group of sectors that didn't receive teacher training or the literacy boost. So why was that necessary? So the purpose is to provide a baseline for comparing the effects of the different groups. So it's there for comparison, all right? That's what a control group is. They might not be able to determine if an increase in literacy rates was due to the treatments or some other change, just because they're getting older, right? So, so that way we have a group to compare to. So blinding and the placebo effect. The drug Azocyte is an eye drop that contains an antibiotic that fights bacterial eye infection. And this study was randomized, double-blind, clinical study. The patients had a diagnosis of pink eye, basically. After 7 days, the percentage of people who were cured was greater in the Azocyte group than the placebo group. Explain what it means for the experiment to be double-blind. So that means not only the sick people, the research, the experimental units, that they didn't know if they were getting the real drug or not, but also the person administering the drug or the non-active drug called the placebo, they didn't know which one the people were getting. Why is it important to be double-blind? Because, again, human nature, let's see what they say. So, knew their eyes would and receive the placebo drops. If the subjects knew they were receiving an active treatment, researchers wouldn't know if any improvement was due to the drops or just the expectation of getting better. If the doctors knew, they might evaluate one group of subjects in a different way than the other group. They might, if they knew and they wanted their study to be successful, they might fudge it a little bit, and make the results look a little bit more impressive than they would have been without knowing. Olive flounder are grown in fish farms to prevent overflowing of wild flounder. Determine which diet produces the greatest weight gain. 28,000 flounder were randomly distributed into 6 concrete tanks. Researchers then compared 3 different diets. Standard diet, which is there for control. A diet in which 20% of the food was replaced by fish meal, and a diet in which 30% of the food was replaced by fish meal. Each diet was randomly assigned 2 of the 6 tanks and the weight of 20 randomly selected fish from each tank was ordered from 0, 8, 16, and 20 weeks. It's weird. Sometimes it didn't make sense. Describe how the researchers could have randomly assigned the diets in the tanks to a completely randomized design. So some people draw a picture of this, some people just describe it. You could write con on 2 slips of paper, F20 in 2 slips of paper, F30 in 2 slips of paper, put all the slips of paper into the hat, mix them well, shake the hat, and then for each tank, draw out 1 slip of paper without replacement and give that tank the corresponding diet. Tanks with the con slip will receive the standard diet. They get the F20 slip and will receive the F20 diet, and the tanks will get the F30 slip and get the F30 diet. Okay, what is the purpose of random assignment? I want you to know these 2 things about random assignment. So they create roughly equivalent groups. And because of that, you might be able to prove cause and effect, right? That's what we want. We want random assignment, or else you're not going to prove cause and effect. Let's see what they say. Purpose of random assignment is to create 3 groups of tanks roughly equivalent in terms of every variable that might affect weight gain, fish size, AH size, etc., before the treatments were assigned. This allows the researchers to make cause and effect conclusions. So we have to have random assignment because we want roughly equivalent groups, which can produce cause and effect conclusions. Cystic fibrosis is a genetic disease that affects organs, causing the mucus to become unusually thick and sticky. This in turn creates numerous health problems for people who live with cystic fibrosis. Trikafta is a treatment for this disease that involves a combination of drugs. One clinical trial randomly assigned 403 patients with cystic fibrosis to receive a daily treatment of either 375 milligrams of that drug or 375 milligrams of a placebo treatment or no drug, like a fake drug, like a pink pill, sugar pill. During the study, all participants took medication twice a day with fat-containing food and continued on their therapies. Happily, the results of the trial showed that after 24 weeks, the drug group had an average improvement. It was 14.3 percentage points greater than the placebo group. That is a statistically significant difference. Identified 2 variables the researchers kept the same during the experiment. So what did they keep the same? Well, they gave the same amount of the drug, 375 milligrams, even though one was just a sugar pill. They took the medication twice a day with fat-containing food and continued with their CF therapy. So both groups did that. Same dosage, same length of time. Describe a benefit of keeping the variables the same. So if the patients took dosages at different times of day, it might be more variable than if they took the dosage at the same times. The increase in lung function variability would make it harder to find convincing evidence that the drug is more effective than the placebo. That's your lesson for today.